Hello, everyone. Greetings for the day. I am Priyanjali from All About Skin Wellbeing. I'm sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infections or mycosis are diseases caused by fungus, yeast, or mold. Mild fungal infection can look like a rash, can be itchy and annoying. So let's connect today with our skin expert, Dr. Mythreyi Rajendran, live from Chennai to enlighten us on the topic of fungal infection. Dr. Mythreyi Rajendran is a clinical dermatologist specializing in dermatosurgery and aesthetics with over 6.5 years of experience. She pursued her MBBS and MD in dermatology at Sri Ramachandran Medical College and Research Institute and undertook special training in cosmetology and dermatosurgery at Stanley's Government Hospital. She is currently practicing at Miller Skin Hair and Laser Clinic, Ashok Nagar, Chennai. And today we have her here with us on the screen. Dr. Maitri Rajendran will share her insights on fungal infection. And let's quickly dive into the first question, Doctor. What
Yes.
is fungal infection, according to you?
So, infection per se, it's an infection caused by fungus, as we all know. But fungal infection, I mean, fungus can affect, even internally. But what we are going to talk about is a skin fungal infection. It is somewhat very common nowadays because once it used to be not very common, we don't see much of patients. But right now, like day in and out, we keep seeing patients with fungal infections because, the environment, everything has like more and more fungus, and there are more opportunity for the fungus to grow on human skin. So it is a very, a very common infection. But the thing is, the symptoms are quite worrisome for the patients because there will be itching and the rashes can be visible. Per se, fungal infections, especially when it is superficial, because there are also deep fungal infections, which has to be considered a bit serious. But the superficial fungal infections does not actually harm anyone, like as in there is nothing harmful about it, but just the symptoms. And since it is an infection, it is contagious to other people and also within us, like within the same person, there can be the fungal infection can spread from one place to another place. So that is why we have to be aware of what it is and how to prevent it, or like when you get it, what to do about it.
Right, right. Doctor, speaking about that, tell us, how does one know in the early stage this is fungal infection? How do they differentiate fungal infection from the rest of the other infections?
Okay, so the rash is pretty it is visible, of course, on the skin, and there will be intense itching most of the times. For very few people, the itching will be very less. The rashes, to look at it, most of the times it looks like round rashes. We call it as ringworm. It just appears in the form of rings, so that is what it's called as ringworm. So the rashes are quite, we can identify the rashes. Just that, nowadays many people before meeting a dermatologist are, they just seek treatment from nearby pharmacies, medical shops, or and all that. Or sometimes their friends tell them some cream names. When they use a cream which is not supposed to be used, that is when the infection, as in the rashes, starts looking different than how it has to be. So otherwise, when a person starts having the rashes, it is very easy to identify.
Right. Now, diving into the uh, well, doctor, the question is, does fungal infection in different areas or different places in our body have different causes behind it, or the cause is almost the same?
No, fungal infections are all caused by fungus. Of course, the fungal organisms, there are different fungal organisms. But when when there is fungus on the scalp, most of the times it is caused by specific fungal organisms. Like in the same two three groups, different species or different
Mhm.
names of the fungus we can say. But otherwise,
Right.
and fungal infection on the scalp is not very common. But fungal infection on the
Hmm.
skin, on the body, and the groin, these are all very common.
Right. What about the fungus, the treatment of the fungal infection? Is it almost the same, or
No.
Are there different treatments for different kind of fungal infections?
Okay, not actually. For fungal infections, like there are like very superficial fungal infections. When we talk about fungal infections of the skin, there are two fungal infections that is very common, which is a pityriasis versicolor. That is very common, like that is very superficial, and also tinea. That is what we were talking about as in the ringworm. So when it comes
Right.
to tinea infections, most of the times we'll have to take a course of oral medication as well, like oral antifungal, because it is quite stubborn. And apart from that, we'll have to use topical creams also. And with respect to versicolor, which is pityriasis versicolor, so that is like, as I said, it is a very superficial fungal infection. Most of the times just the topical medication alone will be sufficient, and the spread of infections is not that fast or that severe when it comes to pityriasis versicolor. And yeah, apart from these common infections, the same fungal organisms can affect your scalp, like we were speaking, can affect your hair follicles as well. And the deep fungal infections, it is something like, the diagnosis has to be, it cannot be diagnosed by the common person, as in, like, they may have rashes and all. Sometimes they'll not have rashes. There may be some just like, pus discharge or something like that. But the
Hmm.
common things that we see nowadays are the superficial infections. So the
Right.
treatment
Now
duration and the
let's.
molecule varies.
Right. Right. So, doctor, among these kinds of fungal infection that we are talking about, there is one particular sort of fungal infection which happens in the nail area, and we usually see the women of our in household, they usually suffer from fungal infections in the nail. Uh, what is the kind of treatment that you normally offer? Does it takes time to get cured or healed?
Yeah, almost the same fungal organisms, but it causes infection on the nails. Just that, like, but usually, whenever there is something wrong with the nails, comparatively, when something is wrong in the skin, it pretty much heals faster comparatively. But when there is nail involvement, usually it takes longer time because the cells itself is like pretty hard over there. So whatever medicines that we use, be it topical or oral, it usually takes time, so the longer time to heal. So the course of medications, usually when it comes to fungal infection in nails, the minimum course itself will be 3 months. Sometimes it can be prolonged as well.
Right. Doctor, the major issue when it comes to treating fungal infection is the recurrence of it. So, why does it normally happen? Why does it recur mostly?
Okay, so the main common reason for recurrence is sometimes, like most of the people, when they are prescribed some medications, like be it oral and topical, they just, most of the times, they just stop using the medicines whenever they feel like the fungus is gone. It is not actually the fungus is gone, it's just the rashes that had started, disappearing, or it just disappeared. But the
Mm-hmm.
fungal organisms does not, like, go off very easily. So people stop using the treatment, stop using the creams or medicines once they start seeing improvement on the skin. So this is one of the very common reasons, like, once the antifungal treatment has been stopped, the fungus usually within the next few days, it again, like, grows over there. So the course of the medication has to be completed, whatever that was advised by your dermatologist. And also, improper, irregular courses, like people buy medicines on their own. Whenever they see rashes, they just use it for like 1 or 2 days and then stop. So this again, like, causes a major concern, because when the course of medication, just like how for antibiotic, if it is not followed properly, there is going to be resistance that is being developed for antifungal medicines as well. So this is also one of the reasons for recurrence. And like we discussed, we are surrounded by fungal organisms, it's been increasing. So since there are more, like, organisms, and with the humidity that we are in, and all these things, the environmental challenges also are there, like for the fungus to keep recurring in humans.
Mm-hmm. Right. Now, we are talking about treatments and we are talking about how one should not treat himself or herself. Mostly, we get to see the scenario when it comes to fungal infection because we normally know the kind of medications that are used to treat fungal infection, or anybody amongst our family might have suffered from the same. Doctor, how does one maintain a healthy, a hygienic environment at home if somebody is already suffering from fungal infection in a home situation?
Okay. First thing is washing clothes separately until that person is completely,
Hmm.
the complete treatment is over. And also, anyways, all of us will be having, certain personal hygiene measures, as in, normally we should not share our towels or soaps. And, during the fungal infection that is active in one person in the family, like I said, washing clothes separately. And even for the same person, when they are using the towels or soaps, if they have fungal rashes, it is always better to have a separate towel and soap just for the rashes. And better not to use the same towel on other parts of the body. So yes, like not sharing personal things like combs and all, this is the major thing and most important thing that one has to follow.
Right, right. Now, coming to that, doctor, we were earlier speaking about the kind of treatments which are normally being taken by themselves, by the patient themselves. So, doctor, what can be the worst case scenario if somebody is into self medication or self treating themselves?
Okay, most of the times the antifungal creams, the name antifungal creams in the commercial market, usually it has steroid combination as well. So using steroid initially does give the feel that the fungal infection is getting treated, because it has anti-inflammatory mechanism, the steroid cream. So usually people do
Mm.
feel they are getting better, but it's actually kind of like increasing the fungal organism by itself. And also it is going to increase the resistance that is being developed against the antifungal medication. So when a person is keep continuously using these kind of combination medicines, steroid and everything, so it's like feeding the fungus basically. So when they are coming to dermatologist, when we start treating the fungal infections the right way, since there has been some resistance and all that, the antifungal medications might not work well. And also when they are continuously using this medicine for a longer time, it kind of they develop this addiction, meaning the skin starts developing that. As in, when they stop the when they stop the steroid medications, the fungal infections tend to recur, or sometimes we actually do not call it recurrence because it is not being treated in the first place. But the fungal
Mm-hmm.
infections, the rashes tend to become more and more, they feel it is getting worsened. So because it has been masked so far by the steroid cream, once the steroid cream has been taken off, there is going to be worsening. So this feel itself, most of the patients, what they do is, since they feel like once it stopped it's getting worse, and they again go back to the same cream. It is like one loop, they cannot be away from the cream, because it is not treated, actually it is just getting masked by the cream they are using it.
Right. Now, doctor, tell us, can such self medication somehow uh, can the fungus go through evolution? Is it possible that they can change the formation and they can turn into a worst case scenario?
Yes, it can become a resistant fungus, so that when we start giving medications, it might not work the way it's supposed to be. And also diagnosis sometimes becomes difficult, because when they keep using the steroid creams, the morphology of the lesion or the rash, that itself gets changed. So say for example, after 2 or 3 months of using the creams, when the patient is going to a dermatologist, so the rashes is not going to look the same. So since the morphology has been changed, the diagnosis itself can sometimes become delayed, so the right treatment can be started only later part of the time. And also the resistance,
Right,
with the resistance the treatment is also going to take much longer time. For a person, normal person, if it's going to take
right.
just 2 months for the fungus to be gone, with all these
Hmm.
scenario, it's going to take sometimes even 5 6 months also. And the dose of the medication
Right,
that is needed, that that is again increased, so we'll have to give more dose, or more duration of the treatment is required.
right. In such cases, doctor, uh, the fungus is contagious. Like people around us, we are also risking their lives.
Yeah, yes, definitely.
Well, well, we should definitely keep in mind when we are talking about fungal infection that it's not just about you or us that we're talking about. It's all the people around us. We need to be extremely cautious. Speaking of that, doctor, there is another kind of setup where people normally tend to get fungal infections from, which is public toilets. Now, people who are working in an IT sector and who has to uh, visit the toilet, or who has to attend their offices on a regular basis, is the part of their regular routine. So, what kind of preventions do they take in, or let's say, can fungal infections spread through public toilets?
Yes, if they're using it just like once in a while, it's not going to such a short contact. Most of the times, it is not sufficient for the organism to spread. But if they are having to like use it like throughout the day, and it is going to be the same thing days of the months and all, yes, there are chances. So as much as possible, it is better to use clean toilets. If it's not clean, it is not better to use it. And also one can carry the sanitizers kind of things with them, so as much as possible they can use that, so they can make sure it's as safe as possible before using it. And yes, using public restrooms or any public place for that matter increases the chance of spread of infection, especially fungal infection.
Right, right. Now, speaking about women, doctor, we know the area, it's normally moist.
Yes.
Yeah. So how we know fungus also grows in moist areas. So how do one maintain that not so favorable situation for a fungal to grow in their body, especially women?
Yes, so as much as possible, one has to be it male or female, one has to maintain the area dry. As in, I'm not talking about the moisturization. Moisturization, of course, is very important for everyone, but maintaining the area not very damp, that is very important. So like if there is sweat during the work, if someone has to sit for a longer time, if there is sweat retention, one need not sweat profusely, but if there is going to be sweat retention, one has to as much as possible when they use washroom or so, they have to wipe it off, have clean and dry skin as much as possible, and wearing like
Hmm.
cotton clothes and taking shower twice a day. All these things help, not just when someone has fungal infection, even without fungal infection, when they keep using following these measures, that should be fine. And like at home, like when they go to sleep, it is better to avoid wearing in innerwears, and avoiding cloth fabrics that is going to that does not absorb the sweat well. All these things has to be followed.
Right. Doctor, tell us the kind of treatments that we opt for when you're talking about fungal infection, according to the stages, or when early in an initial stage a patient reaches us, what kind of treatment do we normally offer the patient?
Okay, it depends upon the basically the number of rashes
Right,
or the inflammation that is
right.
present in the rashes, or the place that the rash is in. Like sometimes the places can be difficult. For example, if it's going to be in the underarm or in the groin region, usually there is going to be some sort of sweat retention, so it is going to make the treatment a bit difficult. So depending on all these factors, if it is just one rash or two rash which is not very inflammatory, or if it is on the area where it is not continuously in contact with sweat and all, just topical creams, antifungal creams should be enough. But in other cases, oral antifungal has to be started. The dose again depends upon the age and weight of the patient, and the duration of the treatment. It depends upon other factors like the inflammation, number of rashes, and everything.
Right. Moving ahead, doctor, speaking about antifungals, can long-term usage of antifungals somehow uh, have any side effects on us?
With oral antifungals, yes, because the dose, everything has to be calculated according to the age of the patient, and also regarding the comorbidities. Like if someone already is in polypharmacy, like they are consuming medications for other comorbid conditions like diabetes or hypertension or cardiac illness or renal dysfunction. So then, keeping in mind of those things, also will be calculating the dose. So if someone has to use like oral antifungal, sometimes like even oral antifungals, people are using it without the advice of doctor. They just get it from pharmacy and they use it. So when they are using it for a longer time, there are chances of side effects. For example, liver function can be altered. Sometimes renal kidney function
Hmm.
can be altered. All those things can happen as well. So the same reason, like anyone has to consult a dermatologist if they have anything on the skin, not just fungal infection, so that the right and proper time of the treatment, duration of the treatment, dose can be given to them.
Right, right. Now, you mentioned diabetes, doctor. What about diabetic patients? We know diabetes is a condition where the patient, they do not heal easily or normally, let's say. So, does diabetes also make fungal infection worse, or can treatments have a delayed response in the case of diabetic patients?
Yes, it can happen, especially when the sugar is not under control. So the occurrence of fungal
Mhm.
infections can be high in general, and also the time it takes to heal that can be prolonged, and the severity that can be increased also if someone is diabetic, and especially if it's not under control.
Right. So, yeah, but can diabetes also lead to fungal infection, doctor? We have seen a lot of patients who are suffering from diabetes and simultaneously suffering from fungal infection. Also, tell us, has UTI any sort of connection with fungal infection?
No, UTI does not have any connection with fungal infection. And diabetes, it's not like if someone has been diagnosed with diabetes, it just increases the chance of fungal infection. Like I said, if the sugar is not under control, if they have like uncontrolled diabetes, it invites any infection for that matter. So fungal infections are
Mm,
common in someone with uncontrolled diabetes.
right. What about pregnant women, doctor? Can we also suggest them to have such antifungals during their pregnancies?
There are one or two antifungal medications which is considered safe during pregnancy, but not as
Mm,
oral medication. Especially in the first trimester, we do not prescribe any oral medications. We give topical antifungals. Even with topical antifungal, as in the creams, not everything is safe. Not everything is considered completely safe. So just like one or two molecules which is considered safe, that can be given. Since we are not able to give any oral medications, especially when the infection is severe, so during pregnancy, the treatment is going to be like, as in the time that it takes for them to have good results, it is going to be pretty much delayed.
right. Right. Well, now for all the people, doctor, who has a tendency of walking bare feet, or who belongs from the lower privileged class, let's say, maybe because of the profession, they are not able to use shoes or sandals or whatsoever, anything to cover their feet. Uh, can they have that? Are there chances of having ringworms in such cases? If yes, what are the kind of preventions that one can take in?
Okay, walking bare feet does not actually increase the chances, as in there is no significant increase in, spread of fungal infections. But like it is of course a different topic. But walking bare feet can increase occurrence of viral infection, especially the wart that can be increased. Compared to that, there is no significant increase in that. Even with people wearing shoes, if they are not using like proper fit shoes, and if there is like too much of occlusion between the toes, and there is going to be too much of sweat retention and all that, that can actually increase the chances of like fungal infection. So wearing improper shoes, like, or unfit shoes, that can actually increase the fungal infection in the toes and feet.
Right. Doctor, also tell us, if somebody is suffering from fungal infection already, is it also important that his or her partner should also get checked or treated at the same time?
Yeah, it is always better to get checked. I mean, it will not be missed if they have fungal infections. They themselves will come to know, because there is going to be itching, or the fungal rashes is going to be visible. So, if they suspect that there is something they have, it is always better to get it checked in at the earliest, so that they can also get the right treatment at the right time. Uh, Not necessarily any blood test because it's a clinical diagnosis. If you have suspicion, it is better to get a dermatologist's opinion on the same.
Right. We are talking about humans here, doctor, but tell us, is it also possible that one can get fungal infection from pets?
Yes, there is a possibility. Fungal infections can occur in pets also, and there is a possibility that we can, get infection.
Right. In such cases, doctor, the kind of preventions one should take in.
So, with respect to fungal infections, normally whoever has it, humans or pets, avoiding the close contact, avoiding close contact with them is the one thing because it is going to be contagious like that. It is not going to be contagious through air. It is not an airborne thing. So, getting in
Hmm.
contact with the person or whoever is getting infected, whoever has an infection, and also not using not sharing the things whatever, for example, combs that we use for pets, that should not be coming into contact. I'm not saying we'll be using the combs, but using them, handling them, all those things has to be, we have to keep that in mind, so we have to be careful about it. Just the close contact, or even if there is going to be a short contact, for example, giving care and all that, wearing some gloves, and as soon as possible, immediately after that, washing the hands. So all those things has to be followed.
Right. So the basic hygiene, basically, we see a
Yes.
lot of people who are animal lovers. We agree we should all care for uh, the unsaid, or maybe the people, the kinds who cannot speak. We should be open to giving love, to showering love. But we see a lot of people, they are into helping the stray animals, and then they do not wash their hands. They are not maybe cautious about it. Can such situation also lead to fungal infection or any harmful diseases, doctor, in such cases?
Yes, yes, definitely. So there are many zoonotic diseases. Zoonotic diseases meaning which gets transmitted from animals to humans. So it is, as you said, it is not it is not wrong showing love to the stray animals and all that. It is one of the very good things, but we have to be cautious about everything around us, as in we are surrounded by microorganisms. Unfortunately, most of the times microorganisms are not visible to our eyes, so it is better to always follow some personal hygiene measures. Like if you are spending time with stray or any animals for that matter, it is, if there is going to be close contact and all that, it is better to take shower immediately after that, or at least on the exposed areas has to be cleaned properly. So these things have to be followed. There is no excuse for that.
Right. Now, speaking of that, doctor, we also know that women, not only women, men also, we tend to share our clothes with the people who are close to us, or say friends. It's very common between friends sharing clothes. So, can fungal infection also be spread through clothes?
Definitely. If one person has fungal infection, definitely yes, sharing clothes or even sharing towels just for one time can can cause the fungal infection, like can spread the fungal infection. So it is always wiser
Right.
not to share clothes. At least if someone has fungal infection or any rash for that matter, the person has to tell the other person that sharing the clothes of his or her is not a good idea, because yeah, it can spread very easily.
Right. So, speaking of that, we have a similar question coming from a viewer, Tanishka, who asks, do sharing makeup with friends cause fungal infection?
Fungal infections, most of the times we do see on the face also it can happen when someone has any fungal infection, even if it is a pityriasis versicolor type of fungal infection, because that is very common, and most of the times it may not be visible, it may not be greatly visible. So when we look at the skin very close, of course we'll be able to see the rashes. Sometimes if it is just one or two, we may not be able to see it. So those things can spread when we share makeup brushes and stuff. And apart from fungal rashes, if someone has viral infections, so that actually can spread much faster with sharing makeup brushes and stuff.
Right. So, sharing any sort of personal goods which is in contact with your skin can be harmful for you and your closed ones. Now, moving ahead, we have another question coming from Pooja Sharma, who asks, do swimming Water. Can swimming water cause the fungal infection? I think swimming in pools, public pools.
By itself, the swimming water does not cause fungal infection, but the fact that it is being shared by many people, so that is where, because it is a public area, there are more chances for someone to acquire fungal infection from someone else, because again, sharing the same area, sometimes the towels that is available in the premises can be affected. I mean, can be contaminated. So using those towels can increase it. And as such, if someone is there in the pool for a very longer time, of course, the skin is going to be damp and moist for a very longer time. So these are the places fungus loves to grow on. So these are the factors that actually increases the chances.
Okay, so yes, we were going with the question. I think fungal infection that can be caused by water, the swimming pool water.
No, yeah, we were talking about fungal infection in children on the scalp. So
Right, right, right.
yeah, I was saying it just got disconnected. So fungal infection is, I mean, on the scalp is
Right.
more common in children than in adults. But by fungal infection by nature, it has the tendency to cause itching. So with that symptom, parents will be able to recognize it when children has fungal infection. Of course, it's a hairy region, so most of the times they may not be able to see the rash in the beginning, but the itching symptom that gives a cue that someone has fungal infection. So again, more than fungal infection on the scalp, lice and nits are more common reason for children to have itching on the scalp, which is again even more common for them to acquire it from friends. So we cannot actually, unfortunately, we cannot actually advise the children not to be close with the friends. So this is something that is very common. So if while combing or while dressing them up, if parents are able to notice any infection, fungal infection, or even the lice and nets at the earliest, it is whenever we start treating it at the earliest, it is always better with the outcome.
Right. Well, the next question, doctor, comes from Ria Sathi, who asks, "My brother have fungal infection. What precaution should we family members take?"
First thing, her brother has to get it treated. Otherwise, it can increase, and the probability of spread to others also increases. And not sharing the personal things, towels, soaps, all those things, and of course, washing the person who's infected, the washing the clothes separately. That again is that something has to be followed.
Right. Doctor, another question which usually arises uh, when we are talking about any sort of skin infection is because we know it's contagious. Fungal infection is contagious. So, what if somebody is already suffering from nail fungal infection? Is it okay if he or she is cooking the food and feeding the child with the same hand, with the same fingers? Is it fine?
No, it is not actually fine, because it's a fungal infection. It is anyways an infection, so there are chances for it to get spread from one person to another person. So getting it treated at the earliest is very important, because normally, compared to skin, nail is going to take much longer time. And if they are going to have to feed the child, or cook or something like that, it is better to wear a glove so that it does not get transmitted to other people.
Right. Uh, and the last question, doctor, comes from Firoz Khan, who asks, "Does fungal infection leave scar on the skin?"
Most of the times it does leave a mark, more like a blackish discoloration, which just goes off in time. For some people, the tendency of them getting black discoloration for anything is high for some people. In that cases, they can consult a dermatologist for that as well. Get some cream that will help in lightening the skin post fungal infection. But scarring is not very common unless the person has scratched the skin like anything, and that has left a wound or something, and that again leaves a scar. Normally no scars, but marks, yes.
Right. Well, with that, doctor, we had a wonderful discussion on the topic. Before we take a leave, any take-home message for our viewers who have watched us so far?
Yes, with rising, chances of spread of infections, fungal infections, viral and bacterial infections, it is always better to be cautious, following certain personal hygiene measures. With respect to fungal infection, especially when there is humidity, when there is damp around, moist skin, fungus tends to grow on it, just like how we see fungus on the wet floors. So it is better to especially people whose work is like sitting for a longer time. So even if there is no profuse sweating, one has to as and when possible pat dry the skin, keep it dry as dry as possible. Not wearing not sharing clothes, not sharing towels and soaps, that always has to be followed. And like while using public restrooms or public places like common swimming pools or gyms, especially people who goes to gym, they most of the times they'll be carrying their own towels or something. Just make sure you do not place the towel in the common places over there, like not on the gym equipments, not anywhere over there. So that is again one common source of acquiring fungal infection. And one more thing, whenever you see a rash on the skin, anything for that matter, please get your dermatologist opinion at the earliest. When you think that it's going to be some common rash and you follow neighbor's advice or some pharmacist advice and you follow some creams which is not supposed to be used, or if you follow some tablets which is not supposed to be used, that is going to cause major side effects for yourself and it is going to delay the treatment results. So, and the skin rashes, sometimes it may look the same. That is the trick there. Almost all the rashes or most of the rashes might look the same. Only the dermatologist, not like other specialty doctors also. Only the dermatologist can differentiate what rash is what. So please get a dermatologist opinion at the earliest.
Well, that was the expert advice for today. And that was Dr. Maitri Rajendran for us. Thank you so much once again, Doctor, for your valuable time. It has been quite an informative session for our viewers today, and we look forward to many more such sessions in coming times. Also, thank you, viewers, for your excellent participation. For more information and updates on skin health and care, stay connected on our Facebook page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. You all stay safe and stay healthy.